It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plan. Our topic today is inclusive dentistry. And joining me is Dr. Lee Sheldon. Welcome, Dr. Lee Sheldon.
Hey, Joe. Good to see you.
That's good to hear. The reason I asked Dr. Sheldon if it would be all right for me to say inclusive dentistry today because Dr. Sheldon is a specialist. And he started out as a periodontist, and then we knew him as the guy that started solid bite dental implant. And then I also knew him as a guy that did radio and television and joined me with our effort to broaden the education of seniors. And then he started looking at different places around the world and saw what other dental practices were doing. And you said, why don't I do something like that here?
Exactly right.
That's exactly.
Why can't we do that in Brevard County? And we can.
Yeah. And what are you doing with your practice that sort of makes you a little bit different with Matthew and Dr. Furtado?
Yeah, well, we've got both. Matthew is my son, Dr. Matt Sheldon, and we've got Dr. Michelle Furtado, who's a board-certified periodontist. And so all of a sudden, under one roof, we can do almost all advanced dental care without having to go and be referred from place to place. And a lot of patients like that. So that we're talking about the patients that we see, Joe, the patients that we generally see are patients who have given up on dentistry or have dental failures going on in their mouths and they just don't know where to turn. And so by having specialists and two periodontists and the general dentist all under one roof, where we can assess, where we can do the CT scans, we can do the x-rays, and literally we can spend time with the patients to find out what they want and to find out, and for us to discover what we can predictably do so you don't have to have dentistry done and redone. All of a sudden we have everything under control under one roof. And so I'm in control. Not that I'm a control freak, but I'm in control of the specialty work that's being done as well as the general work that's being done, so that essentially there's a supervisory role that I'm now taking to make sure that we're getting the results that we want and our patients expect.
Well, there's a part about dentistry, and I'm sure you know this, but I have to say this from a patient viewpoint. I remember when I first joined the Navy, when there were thousands of us going through boot camp, and we lined up in lines, hundreds long, for dental checks, and then they'd start filling teeth, and they'd do a little drilling, and they got I call it a crowbar in there, and broke teeth, and put fillings in there, and did all this stuff. And I always was terrified of dentists, because I always felt I was going to get hurt. Yeah. Yet, I went to you, and I had a 3-tooth implant done. Yeah. And I wasn't worried about whether I was going to be hurt. I wasn't, I joke with you about, we've joked on various television shows about many aspects of dentistry, and including the time where you were doing the show and you had your choppers there and you turned them upside down and a tooth fell out.
That's right.
And you wanted to reshoot the show.
That's right.
and our television crew said, no, Dr. Sheldon, that's reality. There are things that go right and there are things that go wrong with dentistry, just like any medical practice.
Yeah.
But by doing what you've done with your son and Dr. and Michelle coming in, you have expanded your horizon where you can take your experience now and you can spend more time with your potential patient.
Yeah, our new patient visit is 2 hours. That doesn't mean I'm spending the 2 hours, but our new patient visit, all included with our staff as well as with me, is a 2-hour visit. And it's necessary to do that. Most of the patients, we see all patients, but most of the patients who come into us, you brought up the fear of dentistry, and certainly that's a common thing. And so patients who are seek us out because probably our level of expertise, also because we deal with fearful patients. Not that that's the main thing that we do, but we do that. My goal is to take a fearful patient and make that patient a non-fearful patient. And we're able to do that. Initially there may be medications that we may need to use, or bring in the anesthesiologist in order to put the patient to sleep. They think they need that, and at that point they do. But the nice thing that occurs is as they get used to the visits, and as they get used to us, then they see the visits are comfortable, and we have a number of converts who thought they needed sedation, and maybe they did get sedation the first time or two, but now they're perfectly comfortable having all their work done awake. And that's really the goal.
But you're seeing, since you've done it in your practice, you've reached out to dentists across the United States, as I understand it, to try to see how, based on your own experience, you can help other dentists see how they can do a better job of treating patients across the United States.
Yeah, particularly it's in the periodontal profession, because I am a periodontist. Whether we're doing full service dentistry or not, I'm still a periodontist, and that means that we're trained well beyond dental school, and we're trained in complex dentistry and how to plan correctly.
If our viewers understand what you do yourself, you're sort of setting a model system so that people that are contemplating dental care that have some severe problems, they can have a better feel for who to make a call to, whether it's in Melbourne, Florida, or it's in New York.
Yeah.
If they know what you're doing, if somebody lives someplace else, they can call a dentist and say, well, here's what they do in Melbourne, Florida. Do you have a dentist practice that does that type thing here where I live?
Yeah, and there are very few practices that have periodontists and general dentists under one roof. Very few. Those doctors can supervise the work. They can see the patient for the diagnosis. And they may refer out, but they're always referring out to a general dentist that they know can do the work that needs to be done. We have all different levels of dentistry and training and dental care and interest. And so the periodontist knows who the general dentist is, or the prosthodontist is, a specialist in tooth replacement. The periodontist knows who the best qualified person is to take care of that part of the program. So by seeing the periodontist first, the patient can get the diagnosis and treatment plan, can get the treatment that they need in the periodontal treatment, or the gum disease treatment, or the dental implants in that periodontist's office if necessary. And even if not necessary, will then be referred out to a general dentist who's specifically suited to that patient's needs, so that everything comes out well in the end. Predictability is really the answer here.
It's important.
Yeah.
It's important to understand. And the reason I was excited about, I liked it when I dreamed of the word inclusive dentistry, because years ago, I was having some problems with a tooth here where I kept going through the gold overlay, and my dentist at that time, my general dentist, said it needs to come out.
Yeah.
And so he talked about you. Of course, I already knew you, but he referred me to you, because he said he knew I wanted this thing done the right way.
Yeah.
So he said, here's a recommendation, Joe. And you did the work, and I went back to him to get something else done as part of getting the teeth put in.
Yeah, I did the stuff below the gum line. He did the stuff above the gum line.
So, but we need to do a better understanding of what is available in dentistry. We have a problem right now in the country. I was reading more about it lately, because with the Affordable Health Care Act, and with the numbers of aging that we're having, and with the drop back in, say, doctors themselves, we no longer are going to have the benefit of having a primary care physician. I think that we're going to have more urgent care centers. We're going to have people going from specialist to specialist, or from doctor to doctor. We're not going to have that. We're not going to have that primary care doctor.
Yeah.
Many of us grew up, and you probably did when you were a young kid, have primary care dentist.
Sure.
The guy did everything.
Yeah.
But
the difference is that the everything at that time, and let's say in the 1940s, 1950s, is so totally different from what the everything is now.
Yeah.
I mean, think of what occurred in the 40s and 50s. That was even before the specialty of periodontics was recognized. And so it was a lot of extractions and dentures, or extractions, fillings, and partial dentures. We don't have that now. I mean, we still have that, but people want a higher level of care. They want something that's fixed in place. They want something that looks good. They want something that they can have confidence in. They want something that doesn't move and that looks pretty. That's a totally different level of dental care from what was around, 2 generations ago, which is what we're talking about.
So every show I've done with you, when I look at you and we're talking about that, I'm pushing my teeth together, checking my bite to make sure. Why do I do that?
I don't know.
Does anybody ever?
That's probably why we started the brand name Solid Bite.
But it makes people think about.
It does.
If you're not happy, if you're not happy the way your mouth feels or the way your bite feels, you should do something about it.
If you're not happy with the way your mouth feels, you're thinking about your mouth all the time.
And you're
and you only have a certain number of attention units that you can have. If you're placing 40% of your attention here, that means you've reduced your capacity by 60%, which is very interesting, Joe, because when we see patients and they are restored properly and they're not thinking about their mouths anymore, they start to go out to restaurants, they get better jobs, they get dates, they get married. I mean, there's all sorts of things that occur when the mouth is healthy again.
I don't think about that. But I do now. I think about, you go to a restaurant and you watch people, and I look at people a lot. I think I realize now that some of the people that I've watched were not comfortable with the way everything felt here,
Sure.
And so that's something to think about.
They're excusing themselves to go to the bathroom. They're looking down the menu to see which item is soft enough for them to order. It's a real lifestyle problem that you and I have never experienced.
Oh, I think well, you have, because you ate hard candy twice and broke 2 teeth. We won't talk about that. But I want to look at my questions. You and I get to go on all this stuff.
You're right.
I had a question. I said, what are some of the challenges all dentists face with the changes in the medical care system? I want to make sure that the viewers are aware that dentistry is a medical condition that needs addressing.
Yeah, it's interesting because it is a medical condition which has been totally separated out from traditional healthcare. You see your physician, and the physician sees a problem in the mouth. Well, number one, the physician won't recognize a problem in the mouth because the physician isn't trained to look at the mouth. We have some assumptions. I mean, if the breath is bad, if the gums are bleeding, if the teeth are obviously broken down, then of course the physician knows that something needs to be done and can say, why don't you go see a dentist? But things have happened. We talked about what occurred 2 generations ago. We used to talk about periodontal disease as a disease of plaque, and which it still is, and you've got to floss your teeth better, and that was it. Maybe you have to do some gum surgery. That was it, although we don't do gum surgery for periodontal disease anymore, at least we don't in our office. There are other ways of treating it non-surgically. But what we didn't know was periodontal disease is becoming closely related to heart disease, to asthma, to kidney disease, liver disease, Alzheimer's disease, and that there is real evidence now that if in fact a healthy mouth is there, then the predisposition goes down for those other chronic degenerative diseases. And so we can't just say, oh, it's only the mouth. The mouth is connected to the rest of the body. The bacteria that's there, the immunology that's there, doesn't just stop here. It circulates throughout the rest of the body and can cause problems. So we need to be healthy as well.
If I'm correct in reading your book, The Ultimate Mouth Manual, that an abscess, the thing that causes a root canal is an abscess and that can be an infection.
Sure.
And that infection can spread through the root canal system into your sinuses.
Yep.
And go through your carotid arteries. Am I wrong or not?
Well,
but it gets down from here down to here.
Well, it does because the bacteria and the body's fight mechanism, which is the immune system, is part of a circulatory system. The bacteria isn't part of a circulatory system, but the bacteria is there, and some of the bacteria will get into the bloodstream and will go into other parts of the body. But also we've got this chronic inflammatory thing. We're trying to fight inflammation, which is what's going on here. That doesn't just stop here. Those inflammatory cells do go to other parts of the body and tend to cause inflammation in other parts of the body as well, which means you're going to have damage in those organs where that inflammation
And
goes.
I also, when I was talking to a therapist recently, the therapist was talking about the 2, 4, and 6-inch nerves that are in your neck system that can be triggered. That inflammation from your bite problem, that can trigger inflammation into these short nerves in your neck, holding your head back.
Absolutely can, and vice versa. Cervical problem can be reflected as a TMJ problem, where patients say, I have pain here, but the primary problem is here. We have a TMJ problem, which is where which really is, TMJ defines the joint here, but there are muscles that are attached to the joint, and it's usually the muscles and nerves where the patients get upset, they get headaches, they get jaw aches, and it's a very uncomfortable existence. There are times when I'll refer to the therapist first or the chiropractor first, because when I palpate here, there's more problems than when I palpate here. And that in fact, if this part is taken care of, this part is taken care of too. It isn't just the bite. And as in the old song, the knee bone's connected to the thigh bone, the neck bone is connected to the jaw bone. It is the same thing. True.
But Lee, one of the questions I had, I was going to ask you, what do you see as some of the greatest challenges facing dentists like you that have the periodontal experience, that have the surgical experience, that have the general dentistry experience, and you start seeing all this, and you got involved with dentists all over the country now, and you see that. But I also see there is a very definite need for people to be better informed about periodontal care. Yeah. And we're not.
No, and it's the reason we wrote the book, and the book is in the second edition. You can get it off of my website, drleesheldon.com. You can get it at the Brevard County Public Libraries. All the libraries have it. You can get that book. And one of the things, and this is occurring in medical care too. In fact, it occurs in every aspect of your life or my life. Where you don't know what's going on, you need to be involved. You need to understand what's going on in your mouth, just like you need to understand what's going on your roof in order for you to be able to make correct decisions. There was the time when, the doctor says it needs to be done, well, it needs to be done. That's no longer the case. Consumers are becoming much better educated, and they should be educated with regard to the choices they make. And any choice you make has positives and negatives. And the consumer needs to be able to measure those positives and negatives in order to be able to make the decision for him or herself. That, if we're talking about the challenges are not necessarily the treatment. The challenges are a consumer making good choices for him or herself, knowing what needs to be done from start all the way to finish, knowing whether he or she can afford that or not, and if they can, great, and if not, knowing that there's a lesser treatment plan that the consumer can choose that will be affordable and will give the patient a good result.
But you said something that triggered another thought, and that goes back to something. As long as I've known you, one of the very first things that you talked about was the effect of excess sugar on your body.
Yeah.
Not only on your teeth, but your whole body.
That's right.
And I'm not supposed to hit my microphone, which I just did. But if I did have your I apologize. And now my daughter, who is a nurse, she called. I was talking to my wife about. She said, "I think Dad maybe needs to take another look at his sugar ingestion."
Good.
And maybe I'm
good for her.
But I have to admit that, because we have to listen to people, and I'm hard to convince. I know a person that drinks 3 or 4 diet Pepsis a day. I usually have at least one Coke a day, and I can't stand that diet stuff myself. But is one Coke a day bad or not? I don't know.
It depends on the individual. You and I had this discussion. It was years ago on the air. And you said, as long as it's done in moderation.
Yeah.
And I said, no, Joe.
I know you did.
Because the definition of moderation has changed. There wasn't McDonald's on every corner in 1956 the way they are now. And so if we're not cooking for ourselves and we're not providing ourselves with the correct nutrients, and we tend to get it from a can or from a box or from highly processed food or from fast food, then we're not going to get the nutrition that we need. And that also includes the white bun on that McDonald's hamburger, which is a lot of sugar. And it also includes the white bun, because I showed you a white bun that's 5 years old and it looks exactly the same as it does right now.
But there are more people talking about this than you. You started me on this years ago. And as I've watched more and more doctors and people that write for magazines and write for periodicals and write for the newspaper are talking about doing a better job of what we put in our body.
Well, it's interesting because you now see physicians going on TV and talking about that, which is good. I mean, we all need to understand that, in fact, what's there at the periphery of the food store is much better for you than what's down the aisles. In other words, what's fresh is on the outside. What's down the aisles is canned or boxed. We're always looking for fresh.
But in thinking about my title for the show, Inclusive Dentistry, have we really deviated from what a good dentist should be recommending? What you are talking about right now, excess sugars, types of food we eat, they're all important to the care of our teeth.
They are. And as a matter of fact, if you're getting regular dental care, you're really seeing a dentist more often than you're seeing your physician. So it really is our charge. It is our responsibility to help you with the choices you're making, not just where the crown is going to go or the implant is going to go, but what you can do, what you can put into your mouth and what you should be putting into your mouth in order to be able to be healthy and healthier.
So what do you see in your practice of dentistry with Matthew and Michelle there? And how do you see maybe Dr. Sheldon's dental practice doing some things different than you're doing now?
It could, because we're always looking at new technology. Example right now is that, and we haven't put it in yet, but we are putting it in very, very shortly, is a surgical system where we have to do literally no thinking about surgery during the time we're placing dental implants.
Okay, what do you mean by that?
Well, I showed you a prototype to it a few years ago. Remember how we would put dental implants in to the jawbone on the software, right, and we'd have a surgical guide which will allow us to put the implants in that place.
Right.
That's the older technology. Here's the newer technology. There are times when we're doing dental implant work where we have to trim bone away. There are bumps in the bone. The bone is irregular, and we have to change the position of the bone before we put the dental implants in. So a surgical guide like that wouldn't fit. Well, now a very innovative organization has now developed a two-stage surgical guide where on the CAT scan, we reduce the bone, we put the implants in, and they make a surgical guide where we grind away the bone properly and we put the implants in all at the same time and have a prosthesis, teeth, that are ready to go on those implants all on the same day.
All at the same time?
Very, very, very clean surgery. Yes. And that's available. And these are the technological advances which are really, really exciting. I mean, even the technological advances that we've talked about on the air before, where you can spit in a cup and you can identify which of the 11 bacteria are growing in the mouth so you can apply the right antibiotic if you need to in order to be able to help control the periodontal disease. This is technology that wasn't available when I graduated from dental school, and we're going to see more and more and more of this type of thing.
And I know when you go to a medical specialist, whether it be a dentist, a doctor, or any kind of specialist, you're looking at higher costs of care.
Yeah.
Is there a chance that they're developing a technology that will enable dental implants put in that can somehow drive that cost?
Yeah.
So more people can afford it?
I think so. I'm not sure yet. But we have an example even in our own office. Because through the technology, when we were doing full mouth dental implants and we put fastening teeth in the implants, there was a technology that was developed to allow us to do it faster, and so we could reduce the fees. In fact, we reduced the fees something like 20 or 25%. You know, when you're paying for this kind of a service, you're really paying for our time.
I know.
The less time that we have to take, that will drive the cost down even further. Now, this new laboratory process that we're talking about, my laboratory fees are going to go way up. If my time goes way down, then the patient's going to save more money.
But it's something to think about and something about. That's how dentistry, periodontal care is starting to meet the challenges of the future.
That's right.
Okay. I want to thank you, Lee. Thank you for being here. And I want to thank you, viewer, for watching today's episode of Helping Seniors. I hope you've enjoyed it. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.